Ladies and gentlemen, this is Hiroshi Tamai from Japan. Today, I will present the survey on living conditions of people with Down syndrome in Japan. In Japan, non-invasive prenatal testing (NIPT), which estimates the possibility of a fetus having a chromosomal abnormality using the pregnant woman's blood, has been available since 2013 at medical institutions approved by relevant academic societies. According to the NIPT consortium, of the 1,385 pregnant women whose fetuses were confirmed to have a chromosomal abnormality as of March 2020, 1,083 women, about 80%, choose abortion. We concerned the following factors: widespread stigmatization confronting people with Down syndrome, unsure about their parenting and perceived future concerns, little knowledge of medical assistance and social welfare for raising kids with Down syndrome, immaturity of an inclusive society that accepts disabilities and respect diversity. We face the new ethical problem that a rapid increase in the number of unauthorized institutions. We concern the foreigners, the possibility that appropriate genetic counseling is not ensured, and quality and reliability of testing may not be ensured. And we concern the reasons for going to such unlicensed facilities. One is lack of understanding of the meaning and importance of genetic counseling. The other is lack of knowledge about the actual living conditions of people with trisomy. Many students in Japan do not always have sufficient information about the care and the life of people with Down syndrome, and therefore their understanding is inadequate. Japan Down Syndrome Society, JDS, conducted a questionnaire survey among JDS members to find out the actual living conditions of people with Down syndrome so that the pregnant women can use the survey as a basis for making decisions about their about whether to undergo NIPT or not, or after undergoing the test. The purpose of this survey is to find out the specific information about the growth history, living conditions, and health status of people with Down syndrome, as well as to find out what kind of environment their parents live in and what kind of things make them feel stable or stressed. In July 2020, JDS, in collaboration with the Japanese Down Syndrome Association, JDSA, sent questionnaires to 4,471 regular members of the JDS and received 1,581 responses, 35.4% response rate. There is no significant differences in age between sexes, and the subjects below than 35 years old occupy the majority in both sexes. Nearly 60% of the respondents were generally healthy, have a disease and hospital treatment. Pediatrics, dentistry, and internal medicine accounted for about 30% of their medical care. 23.7% responded for undergoing outpatient treatment, requiring care for daily life and undergoing inpatient treatment, which predicted serious problems in their current health condition. In Japan, support for continuous employment is the service that provides work or training necessary to get a job for persons with disabilities who have difficulties to be employed by ordinary companies. And there is type A with employment contract and type B for those who are difficult to work under employment contract even with support. User of type B and living care facilities account for more than 80% of the total. On the other hand, the combined total of general employment, employment of persons with disabilities in general companies, and special purpose subsidiaries reach 9.7%, and when type A continuous employment is added to this total, the figure is 12.6%, indicating that almost 1 in 8 persons has attained some form of employment. The survey includes questions about eating, dressing and undressing, oral hygiene, bathing, urination, defecation, nutrition management, medication management, money management, use of telephone, decision making such as choice of activities, awareness of risks, cooking, cleaning of living space, washing of own clothes, shopping, use of public transportation. Although we have only included eating and dressing here, we found that in almost all of the 17 items we surveyed, the level of independence was greater for women. Behaviors seen in daily life. More than half of both male and female respondents reported that they were obsessive, talking about the same things over and over again, difficulty concentrating, and refusing help were reported by more than 20% of respondents, indicating that difficulties in daily life can be expected. Other than the above, shouting or making strange noises, not being able to speak coherently, making up stories, emotional instability, collecting and hoarding things, feeling anxious or worried about interpersonal relationships, high anxiety and tension in interpersonal relationships, victimizing and rejecting attitude, maladjustment to group life, repeating the same behavior over and over again. Symptoms that made parents think he or she had dementia. Functional decline in motor aspects, slower movement, slower gait, and overall tiredness. Emotional changes, expressionlessness, less talking, and tearfulness and destructibility. Disorders of executive function, in a solitary world, became unable to wash bath without assistance. Three patterns have changed. Stopped participating in daytime or outdoor activities. Stopped working in the middle of a task. Became incontinent. The percentage of respondents who said they became easily confused, which may indicate a decline in short-term memory, was 13.6%. Interpersonal factors that served as encouragement sources for parents. Concerned with factors indicated in below. In the fathers group, only words and actions of strangers tended to be stressor rather than encourager, while all other factors were encouraged rather than stressor. In the mothers group, two factors tended to be more of a stressor than an encourager. One is the words and actions of strangers, and the other is the words and actions of government officials. All other factors tended to be more encouraging than stressful. The income distribution of the respondents shows a tendency to have fewer low income groups compared to the distribution of the nation as as a whole, which may support the social anxiety that there is a financial burden in raising a child with disabilities and that it may be necessary to consider effective support measures. At the adult age, almost 1 in 8 people with Down syndrome are able to attain employment covered by the minimum wage law. The relationship between Down syndrome and Alzheimer's disease is an area that has been subject to vigorous research in recent years, and although the numbers are small, data have been obtained that may support the finding that the early symptoms of dementia in Down syndrome may appear more in terms of executive dysfunction than the usual short-term memory impairment. Parents of children with Down syndrome, both fathers and mothers live with more encouragement than stress in their daily interpersonal relationships. Genetic counseling mainly explains disabilities as biological characteristics, but there has been insufficient evidence on disabilities as social barriers, especially on how people with Down syndrome perceive and overcome these barriers. This survey will not only provide children and adults with Down syndrome with a direction for their future lives, but will also provide a high quality basis for the ethical discussion of NIPT. It will be a good resource for pregnant women and their families to learn about the realities of living with Down syndrome. In Japan, there is a need for an organization where pregnant women and their families can consult, similar to the Pregnancy Conflict Counseling Center in Germany, and where efforts should be made to provide unbiased information for pregnant women to make decisions. In addition, there is a need for continuous support not only for the continuation of pregnancy, but also after the birth, including after abortion, and the activities of public health nurses were expected. Conclusion. In order to avoid widening the social divide between disabled, non-disabled, and undisabled, this term coined to mean that anyone can have a disability. The realization of an inclusive society is the only way to overcome such social barriers. Even if the fetus does not have human rights as a law, if we view the fetus as an entity that will have human rights in the future, the direction of NIPT and the genetic counseling could be much different. Thank you for your attention.